Community and Health Services Department. Paramedic and Senior Services Branch. Long-Term Care. Palliative Care Policy and Procedures. Manual Palliative Care Program Policy. Number 2.1, B.2.8. Applies to all LTC staff, residents, substitute decision makers. Effective date: November 1, 2021. Replaces RCO 70000. December 9, 2009. Purpose: this policy outlines the approach to delivering and requirements of providing palliative care. It provides staff with guidance on when to place a resident on the palliative care pathway and how to support the resident, SDMs, family and friends in carrying out any advanced care plans. Definitions. End of life is identified through clinical signs of rapid deterioration and can refer to the last days and hours of life when a person is irreversibly dying. Edith expected death in the home. Palliative care. Person-centered care that provides pain and symptom management and addresses a person's physical, psychological, spiritual, social, and practical needs as the person declines with disease progression or with age. It also involves end-of-life care when that time comes. Policy. The key requirements of this policy are as follows. 1. Residents who would benefit from a palliative approach will be identified and their needs for palliative care assessed. 2. Staff will support the resident to optimize their quality of life, comfort, dignity and security based on their individual needs and preferences. 3. Staff will provide the resident, SDM, family and friends with emotional support, provision of information and dealing with end-of-life choices. 4. Staff will provide timely access to services and support specifically needed on the palliative care pathway. 5. Staff will receive education, training and well-being supports covering palliative care and end-of-life issues. Palliative Care Policy and Procedure, November 2021, page 1 of 6. Community and Health Services Department. Paramedic and Senior Services Branch. Long-Term Care. Procedures. This section contains procedures for the following. A. Assessing and recording the residents for the palliative care pathway. B. Documenting and monitoring of a resident on the palliative care pathway. Assessing and recording residents for the palliative care pathway. 1. Assessment of resident. Registered staff or a physician will consider placing a resident on the palliative care pathway if they recognize symptoms of approaching death ahead of time, if the resident receives the diagnosis of a life-limiting illness at the request of the resident or SDM, in any other situation based on clinical or professional judgment, including being given a palliative care trajectory of B or C. See Appendix C. Registered staff or a physician must place a resident on the palliative care pathway when the Palliative Performance Scale, PPS, for the resident is 60%, see Appendix B, when the resident's changes in health, end-stage disease and signs and symptoms, CHES, score is 5 or above 2. Assessment records and referral. Registered staff must record or update a resident's PPS, Appendix B, or CHES in point-click care, PCC, notify the palliative care team and physician, or nurse practitioner, of the resident's reduced performance, and the need to consider activating the resident's advanced care plan. See NPSSP 4.3 Advanced Care Planning Policy and Procedure. Initiate end-of-life care when disease-specific markers, signs and symptoms indicate the resident appears to be dying and reaching the final stages of life. See NPSSP 7.9 End-of-Life Policy and Procedure. Palliative Care Policy and Procedure, November 2021, page 2 of 6. Community and Health Services Department. Paramedic and Senior Services Branch. Long-Term Care. The palliative care team, or designate, will activate the resident's advanced care plan and ensure a copy is at the front of the resident's chart and in the Administration tab of the chart. See NPSSP 4.3 Advanced Care Planning Policy and Procedure. The attending physician or nurse practitioner, NP, will complete the palliative and end-of-life medication order set, Appendix A1, and EDITH form, Appendix A2. B. Ongoing documenting and monitoring of resident on palliative care pathway. The palliative care team and physician will hold a palliative care conference that includes a review of the resident's advanced care plan, resident's spiritual and/or cultural needs, resident's medication and treatment plans, including any provision of medical assistance in dying. CMD 1.5 Medical Assistance in Dying, MAID. Policy and Procedure. Psychological and well-being supports needed for the resident and their SDM, if applicable, and plan for any memorials required. Determine the frequency of assessments and management of palliative care symptoms, not less than monthly, given the nature of the resident's decline in performance. This includes completing a MDS-RI for significant change for the resident, updating the PSS and CHESS, discuss the resident's decline with the resident, or SDM is applicable, about the change in their care needs and the need to activate their advanced care plan, if there is one, or the need to discuss an advanced care plan, if there is not one, or end-of-life care. See NPSSP 4.3 Advanced Care Planning Policy and Procedure and NPSSP 7.9 End-of-Life Policy and Procedure. Registered Staff Will. Palliative Care Policy and Procedure, November 2021, page 3 of 6. Community and Health Services Department, Paramedic and Senior Services Branch, Long-Term Care. Assess the resident during routine care by asking the resident/SDM about pain, social and emotional needs. See Pain Management Program. Create or update documentation PPS, CHESS, about the resident's palliative care, including the assessment and effectiveness of any interventions identified in the resident's care plan. See NPSSP 4.3 Advanced Care Planning Policy and Procedure. Dietary staff will refer to NC number 9 End-of-Life Care Policy. Complete a nutritional risk assessment. Suggest adequate and suitable fluid and diet intake. Promote favorite foods that can be managed based on the resident's condition. Set up the comfort card and use checklist inside for replenishment. PSWs will provide palliative care to the resident and any end-of-life care needed. See NPSSP 7.9 End-of-Life Policy and Procedure. Assess the resident during routine care by asking the resident/SDM about pain, social and emotional needs. Ensure the resident's care needs are documented in the progress notes. In point of care, POC, roles and responsibilities. Role responsibilities. LTC staff provide residents with the means to optimize their quality of life, comfort, dignity, and security based on their individual needs and preferences. Ensure residents' physicians are always informed about the resident's care, well-being and response to medication or treatment. Comply with the resident's advanced care plan, if there is one. Palliative care team, or designate. Be responsible for activating, or establishing, a resident's advanced care plan. Be responsible for ensuring all assessment and documentation to support a resident's palliative care. Palliative Care Policy and Procedure, November 2021, page 4 of 6. Community and Health Services Department, Paramedic and Senior Services Branch, Long-Term Care, and End-of-Life Care needs are complete. LTC Management, provide the education, training and well-being supports required to implement this policy. Physician/nurse practitioner, optimize the well-being of the resident and prevent suffering. Ensure that the selection of medication is individualized to the person. Prescribe palliative care medication order and complete an expected death in the home, EDITH. Form social worker or designate. Coordinates palliative care conference. Provide psychological support. Dietitian/diet RE staff. Be responsible for ensuring dietary and nutritional needs of a palliative care resident are met. Set up and maintain comfort chart. Authority Long-Term Care Homes Act, S.3, 1, S.8, S.76, Ontario Regulation 79/10, S. 29, S. 42, S. 227 1, Healthcare Consent Act, 1996, Substitute Decisions Act, 1992, Accreditation Standards, CARF, 2.A.48.c. 11, 2.A.51 and 3.C.32. Related resources. 1.0 Palliative Care Program Table of Contents. 1.1 Palliative Care Program Description. Appendix A1, Palliative and End-of-Life Medication. Order set. Appendix A2, EDITH Form. Appendix B, Palliative Performance Scale, PPS. Appendix C, Palliative Care Trajectory. NPSSP 4.3 Advanced Care Planning Policy and Procedure. NPSSP 7.9 End-of-Life Policy and Procedure. MD 1.5 Medical Assistance in Dying, MAID, Policy and Procedure. NC Number 9 End-of-Life Care Policy. Approvals Manager, Policy and Planning, Manager, Production and Services, Directors of Care, Medical Director. Palliative Care Policy and Procedure, November 2021, page 5 of 6. Community and Health Services Department, Paramedic and Senior Services Branch, Long-Term Care, Administrators, and Director of Senior Services. Policy Contact, Senior Program Analyst Review. Period. Annually. Palliative Care Policy and Procedure, November 2021, page 6 of 6.